everyone, this is Jaeger Spratt. I am PHA's Advocacy and Treatment Access Program Manager. I use they, them pronouns, and today I want to talk to you about what's new with Medicare. The biggest change is that there is no more 5% copay once Part D beneficiaries reach the catastrophic coverage threshold. Now, there is a big ol' asterisk on that only applies for drugs that are covered by your insurance under the Part D benefit. So that would not apply to any Part B prescriptions. In 2024, Medicare Part D plans would enter the catastrophic coverage threshold when a beneficiary's out-of-pocket costs reach $8,000. So once your out-of-pocket drug costs reach $8,000, then you would automatically enter the catastrophic coverage phase. After this point, you will pay nothing for your covered Part D drugs for the remainder of the calendar year. Things that count towards your out-of-pocket costs for these purposes include, firstly, your deductible, if your plan has one. Some Part D plans don't have deductible. Also, your copay or coinsurance costs that you paid during the initial coverage period. Additionally, it also includes amounts paid by others on your behalf. So this includes manufacturer discounts, most charitable assistance through nonprofit foundations, as well as programs like Medicare Extra Help and the state pharmaceutical assistance programs. So what things would not count towards your out-of-pocket costs for the purposes of reaching your catastrophic threshold? Those things that don't count would include your monthly insurance premium, the amount that your Part D plan is paying for your drugs, also the cost of any non-covered drugs, anything that would not be on formulary, and also the cost of covered drugs if you get them from a pharmacy that would be outside of your plan's network. So you would have to be on formulary within network for that to go towards your out-of-pocket cost. So, how do you know when you've reached the catastrophic coverage threshold? Your Part D plan should be keeping track of how much you've spent out of pocket for your covered drugs, as well as what coverage phase you're in. That information should appear on your monthly statement or the explanation of benefits document that comes from your Part D plan. Now, if you think that you should be at the catastrophic threshold, or if you were expecting to see some kind of a discount that is not appearing on these statements, then you would need to reach out to your Part D plan provider to check and make sure that your prescription records are correct and that they're up to date. Starting this year, people with Medicare whose income is at or below 150% of the federal poverty level are eligible for full benefits under the Part D low-income subsidy program. So previously, there was a partial low-income subsidy benefit in place for individuals with incomes between 135 and 150% of the federal poverty level. That's now been expanded to cover all the way through 150 at the full benefit. So that's everything. Thank you for watching. I really hope this information helps you in planning out your prescription expenses for 2024. There are going to be more positive changes for Medicare coming in 2025, so be sure to keep a lookout for that information towards the end of this year. Thanks.